Welcome on my channel Charming Science. Today we are going to talk about the bone humerus. So first of all we will get the knowledge that what is the humerus and how we are going to identify this bone. So humerus is the largest and the strongest bone which is present on the upper limb. It is consist of a upper end, having a upper end, lower end, and the shaft. When we look talk about the how we determine the side of it, so when we are going to see the bone, then we see that the upper end of the, we'll mark it with a green. We'll let it green color. Yeah. So when we are going to determine the side of the humerus, then we look at the upper end. The upper end is the round in structure. As we can see, this is the upper end. So we can see this is the round in structure. We see that the upper end is the round in structure and the lower end is expanded from side to side and flattened from backward. When we look at the lower end, then we say that it's extend at the both side from the lower end. So this structure is known as the lower end of the humerus and it's flattened from the backward. The head is directed medially, so we get to know about how to identify the superior and inferior part of the humerus. Now we look at to the how to identify the medial and lateral part of the humerus. The humeral head. This is the humeral head. It lies medially, upward and backward. And then there is having a one tubercle which present until the front of the upper end is limited laterally. And when we talk about how we identify the anterior and the posterior part of the bone, then when we see the posteriorly when we see a structure fossa is present posteriorly. There is having a fossa present. That is now how we get to know about or how we determine the sides of the humerus. The upper end is having a rounded spherical head, the lower end having a flat and enlarged bony landmarks which is present. Medial, the round head is present. Posteriorly having an fossa that is present or a groove like structure that is present in the humerus. So when we look into the bone, the upper head, when we look for the upper head, we'll talk about this attachment later. When we talk about the upper head, we will see that the upper head is a smooth rounded, as we see it's a rounded structure. It's a rounded structure that is present on it. So it's a smooth rounded and form 1/3 of a sphere. It is covered by an articular hyaline cartilages, thicker in the center and thinner at the periphery. when we are going, we will also see the anatomical neck. So this is the line. This is the line where the sphere is formed, or the round head of the humerus is going to form. That line is known as the anatomical neck. It is constricted at the margins of the rounded head. Where the margins of the rounded head is formed, there is the anatomical neck is present, and it provides attachment to the capsular ligaments of shoulder joint. There is having another landmark that is known as the surgical neck. The surgical neck is generally present in this fashion. Surgical neck is present in this fashion. So from this point bone becomes straight. Surgical neck is the point. Sorry, this one is the point. Surgical neck is the point from where the bone is going to straight. So means that the shaft that will fall downward, the inferior part of the humerus bone that lies below the head, it's going to be a straight, more straight. Not absolute straight, but it's more a straight manner. It is a short constriction of the upper end of the shaft below the greater and the lesser trochanter. Sorry, below the greater and the lesser tubercle. Let me remove it first. Another one. So this is the line where the surgical neck is formed. Then we talk about the greater tubercle and the lesser tubercle. The lesser tubercle is an elevation on the anterior aspect of the upper end. When we look at the upper end of the anterior aspect, then we will see that there is having an elevation. We can see that as an elevated part. This part is known as the lesser tubercle, and the greater tubercle is an elevation that forms the lateral part of the upper end. So this, as we talked before, that this one is the medial part, this one is the lateral part. So when we see the laterally, there's having an elevation that form, sorry, it's by mistake. This is the part which is known as the greater tubercle. Greater tubercle is an elevation that form the lateral part of the upper end. There is having a part that is intertubercular sulcus. The intertubercular sulcus, it is also known as the bicipital groove that separate. I will draw it in a different with a different color. So this part is known as the intertubercular sulcus. It's a groove-like structure, or it is also known as the bicipital groove that separate the lesser tubercle medially from the anterior and the anterior part of the greater tubercle. The sulcus has medial and lateral lip, so it's a groove-like structure. So it's also having a medial lip which lies toward the medial side of the bone, and the lateral lip which lies toward the greater tubercle. And when we talk about the structure, then we will see talk about the one thing that morphologically, if we see the bone, then above the surgical neck 0.5 centimeter, we will talk about the little bit more of size. Yeah, approx this level, the epiphyseal line will be there. when we are going to talk about the bone which is present in the children's, then we will see the epiphyseal line at there. Imagine when we are going to see the posterior aspect of the bone, then we also see the greater tubercle. It's this we talk about the greater tubercle that is present here. The lesser tubercle will not be visible from posterior view. The surgical neck is the neck line from where below the bone is going to straight. The shaft, the radial groove, there is having a structure that is a radial groove that is present on the shaft. Soft surface, and there is having an anatomical neck and the head of the humerus. These are the major structures that is present on the head of the humerus. When we are going to see the muscles attachment, let's first complete all the landmarks which is present on it. Then we will talk about that. The inferior part, when we look at the inferior part of this humerus, then we will see there is having a shaft. There is having a shaft of the bone. There is having a medial supracondylar ridge that is present. When we talk about the lower end of the bone, then we will see that it's a flattened from below backward. When we see the shaft, then it's a flat structure that is present from the backward and expanded from side to side, and we will see that this structure is the expanded is from side to side. Generally the lower end have approx 7-8 features, so we will talk about that. The first, as we see, that is the shaft, that is the continuity of the bone. Second one is the medial supracondylar ridge. There is having two ridges that are present onto the bone, that is the medial supracondylar ridge, which is present on the medial side of the bone. This is the medial side, so there is having a medial supracondylar ridge, and there is a ridge that is present on the lateral aspect. This one is the medial supracondylar ridge, and this one is the lateral supracondylar ridge, which is present on the medial one is present on the medial side, the lateral one present is on the lateral side. There is another structure that is present is the coronoid fossa. The coronoid fossa is a small fossa that lies above the trochlea, and in this the ulna going to fit into it during flexion. So when we are going to do the flexion, it's a depression. When we talk about the coronoid fossa, then we say that it is a depression just above the anterior aspects of the trochlea, and it accommodates the coronoid process of the ulna when the elbow is going to flex. When the elbow is going to flex, the coronoid process of the ulna is going to fit into it. There is another structure that is the medial epicondyle. When we say about the medial epicondyle, this is the structure. This structure is the medial epicondyle. It is a prominent bony projection on the medial side of the lower end. It is subcutaneous, so it's mean that we can feel it underneath the skin, and we can feel it on the middle side of the elbow or the humerus. There is having a structure that is the lateral epicondyle that lies laterally to the bone. It is a the another difference is between the medial and the lateral epicondyle is that the lateral epicondyle is smaller than the medial epicondyle, and it's present little anterolateral part on the bones. When we talk about the trochlea and the capitulum, there is the structure trochlea and the another structure is known as the capitulum. So the trochlea is a pulley shaped surface. It articulates with the trochlear notch of the ulna. There is having a structure that is trochlear notch that is present on the ulna. So the trochlea will lies or articulate with that. The medial edge of the trochlea project down 6 mm more than the lateral edge. So it's mean the trochlea is little lower. When we're going to measure the size, then we will find that the trochlea lies little lower than the capitulum, and this result in the formation of the carrying angle. Due to having a little more downward than the capitulum, it forms the carry angle in our hand. That's help to keeping away our hand during the walking or during the swinging of the arm while walking. There is a structure that is the ninth one, capitulum. Capitulum is a rounded projection which articulates with the head of the radius. That's the same thing that when we are going to see the bone in the posterior aspect, we will see the lateral supracondylar ridge which lies toward the lateral side of the bone, the lateral epicondyle. This is the structure that is present the lateral epicondyle, medial supracondylar ridge that is present on the medial side, medial epicondyle, that is the structure. There is a structure that the olecranon fossa and the sulcus. Trochlea, we talked about that. This is the structure of trochlea, we talked about that. We have to talk about the olecranon fossa and the sulcus of the ulnar nerve. So the olecranon fossa lies just above the posterior aspect of the trochlea. When we talk about the trochlea, just above the structure, this is the structure that is the olecranon fossa that is present on the posterior aspect little above the trochlea. It accommodates the olecranon process of the ulna when the elbow is extended. So when the elbow is extended, the olecranon process is going to fix in it, and when the elbow is flexed, then the coronoid process is going to fixed in a coronoid. This is all about the lower end. When we look the bone from the inferior view, then we will see, we will start from the first, that is the trochlea, capitulum. Trochlea is a pulley shaped surface, is articulated with the trochlear notch of the ulna, and it is 6 mm below the capitulum, so it forms the carrying angle. Sulcus for ulnar nerve. Sulcus for ulnar, there is a little groove like structure that is present from where the ulnar nerve is going to pass. There's, sorry, it's a medial epicondyle. This is the, sorry, this is the groove for the ulnar nerve, and it is palpable ulnar nerve. This is the medial epicondyle, and this is the lateral epicondyle that is present on the inferior angle of the humerus, or the inferior side of the inferior aspect of the humerus. So let's come and talk about that are the muscles is going to attach, the muscles which are going to attach on the surface of the humerus. So first of all, we are going to start it from the head. So when we are going to start from the head, will see the first muscle, that is the subscapularis. When we see the subscapularis muscles is going to insert. Subscapularis muscle, we see that this is a prominent structure that is present on the anterior side, so it means that it is the lesser tubercle. So the subscapularis is going to insert onto the lesser tubercle of the humerus. Then there is having a triceps brachii. Then it's having a triceps brachii. The medial heft of the triceps brachii is going to the medial head of the triceps brachii is going to originate from here. The coracobrachialis. The coracobrachialis muscles is going to insert into the rough area on the midline of the mid border. So when we see the shaft of the humerus, this is the part where the coracobrachialis is going to insert. The pronator teres muscles, when we look at the inferior end of the humerus bone, then we will see that the pronator teres muscles is going to originate from here. It arises from the lateral 1/3 of the medial supracondylar ridge. 1/3 of the medial supracondylar ridge, this is going to originate. The fifth one is the origin for the common flexor muscles. The common flexor muscles is originate of the forearm. The common flexor muscles for the forearm is going to arise from the anterior aspect of the medial epicondyle. When we talk about the sixth one, that is the supraspinatus. So the supraspinatus muscles is going to insert into the uppermost impressions on the greater tubercle, into the uppermost part of the greater tubercle. When we look the muscles, the pectoralis major, this is the part for the pectoralis major. So we see that the pectoralis major is going to insert onto the lateral lip of the intertubercular sulcus. Going to insert on the lateral tubercular sulcus. When we see about the latissimus dorsi, that one is the 8th landmark. The latissimus dorsi, this one is the area latissimus dorsi. It is inserted onto the floor of the intertubercular sulcus. Well, inserted on the floor of the intertubercular sulcus. When we talk about the teres major, then we will see that it's going to insert on the medial lip. Medial lip of the intertubercular sulcus. When we talk about the 10th one, that is the deltoid. When we talk about the deltoid, then it's going to insert onto the rough area of the middle. When we talk about the deltoid, it's inserted onto the deltoid tuberosity that is present onto the shaft, lateral side of the shaft. Brachialis, this is the part for the brachialis muscles. The brachialis muscles arise, that is going to originate from here. So it's arise from the lower half of the anteromedial and anterolateral surface of the shaft. The brachioradialis, the another muscles is the brachioradialis. So the brachioradialis is also going to originate from the upper two-third of the lateral supracondylar ridge. The extensor carpi radialis longus. So it's going to arise from the lower one-third of the lateral supracondylar ridge. And when we talk about the common extensor origin, then we say that it's going to arise from the lateral epicondyle. If we see the posterior aspect of the humerus, then we see that the infraspinatus muscles, the infraspinatus muscles is going to insert, there is the infraspinatus muscle, so the infraspinatus muscles is going to insert into the uppermost impressions on the greater tubercle. When we talk about the teres minor is going to insert into the lower impressions of the greater tubercle. When we talk about the triceps brachii, lateral head, then we will see that the triceps brachii of the lateral head, this is going to originate from the oblique ridge on the upper part of the posterior surface above the radial groove, while its medial arises from the posterior surface of the radial groove. The deltoid muscles is going to insert here. Brachialis muscles, the brachialis muscles is arise from the lower anteromedial and anterolateral surface of the shaft. The triceps brachii medial head. When we look at the posterior aspect, then we see that the triceps brachii medial head is going to originate from here. And the seventh one is the anconeus muscles. The anconeus arises from the posterior surface of the lateral epicondyle. So I hope it's going to be clear for you that which are the landmarks which is present on the humerus and what are the important muscles is going to attached on to the humerus. That's all for today. Thank you. Charming Science.